Yeah, hello.
All right, thank you so much. So just to introduce Mr. Ernest Akyereko again, he is an epidemiologist with excellent expertise dealing with tasks related to early detection, management, and control of infectious diseases, as well as competence in the performance of geospatial analysis and modeling of infectious diseases. He has been influential in developing standards and guidelines in the investigation of causes of pandemic diseases and other ill health conditions. He is currently the team lead in COVID-19 data management and situational updates at the Ghana Health Service, Accra, Ghana. Audience, help me welcome Mr. Ernest Akyereko. Mr. Ernest, you can take over.
Okay, thank you very much for the opportunity. And then I would also like to take this as a unique opportunity to highlight some of the key things Ghana has done as far as the COVID-19 is concerned, and which areas for which we've used GIS. So we'll first of all look at the background, and then also look at what have been the focus areas of COVID-19 and how has GIS been helpful in this. And then later we'll look at some distributions of cases and mortalities over the year. And then we can discuss the way forward, other innovations, other thinkings that can come up. So when you look at this, can we go back to the previous slide? Yeah. So this actually shows the movements of individuals across the globe. So this map is very important as far as epidemiology is concerned, because once you see this, it speaks a lot. It tells you that once there is a disease anywhere, then the disease can easily spread from one place to the other. And this was actually mapped using geospatial technology. So it tells you that geospatial technology has actually been part of health, long time ago, starting from Socrates' time up to John Snow's time and all that. There have been evidence of this. So can we go to the next slide?
If the limit is not in person and it has to be virtual, I still think it's necessary before we kickstart. So
can we move to the next slide? Okay, so what has been the chronology of events of COVID-19 in Ghana? We recorded our first 2 cases in March, and then which actually took us by surprise, even though we're not so surprised, we're expecting that to happen. But after that, we've had a surge in cases over the time, somewhere in May, June, July, August, and then subsequently in 2021, when we had an increase in cases somewhere from February. So, and this have actually been very close with how we accept or how we use the face masks. But then these maps you see down here shows how we have the disease moved from Wuhan and spread to other areas. So can we go to the next slide? Okay, so what has been the overall goal of the Ghana COVID-19 response? The goal of the response is to reduce the incidence, mobility, and mortality of COVID-19 pandemic by strengthening national systems and community capacities to respond and manage efficiently health risk posed by the pandemic. So that is the overall goal. So what have we been able to do with that? So these goals are summarized into limit and stop the importation of cases, detect and contain the cases, slow down community spread, provide care for the sick, and then also limit the social impact and economic impact, and also improve domestic capacity and resilience. Next slide. So which areas have we been able to apply GIS? We've done that in our dashboard, heat maps, contact tracing, risk map, and virtually everything that we do. So let's go to the next slide. So we look at limit the importation of cases, and that's, we've done a lot of work at the Port Health, and we actually issued advisory to people coming from China, Italy, Iran at the beginning. And this was done based on, let's go to the next slide, based on also observing what is going on at the globe, and then what is being shown there. So if you look at what we have, can we go to the previous slide? Yeah, so this slide actually shows like the distribution of cases along the globe. So we are not only using it internally, but we also source information from other sites who are currently using the GIS technology in order to know which areas that we should focus and issue advisory. And then this board, we have a similar one with WHO and other sites, which we use to support our decisions. So let's go to the next slide. So based on that, what have we done? What we've been able to do is currently is to digitize the health declaration form. So our health declaration form that we used to do where we were using sheets of papers now have been digitized. So we are able to pick this information direct and feed it onto our system, which we are able to showcase on our dashboard using the GIS, but we'll get to some of these things for us to see. So what have been the issue about detection of cases? So the detection of cases has to actually do with early identification of cases, and then also rapid response to the cases and contact tracing, and then deployment of SORMAS, for which we will talk about in later presentations. So let's move. So as part of our COVID response, we did what we call enhanced contact tracing. And this enhanced contact tracing was based on the initial cases that were identified as a country. So what we did was to geolocate all the initial cases that we got and also do a 2-kilometer buffer around each of the geo cases and do what we call some form of survey sampling to understand the extent of community spread as far as the COVID-19 is concerned. So in this case, the ArcGIS was very influential in actually doing the enhanced contact tracing, for which we think was one of the key things that help us in reducing the number of cases, because most of the cases were detected at early stages in these communities. And that, if was not done, we think could have influenced the spike that we would have gotten within that period, for which we think that our system would have been overwhelmed. So this played a critical role because most of these people were detected early. So based on the use of this our GIS, we are also able to show spatial distribution of cases by districts and by regions. And what we see at your extreme right is the active cases that we see, and then the cumulative cases, and then which districts are we supposed to look at and where we could focus. So this is how influential COVID ArcGIS has been in terms of its application to COVID in Ghana. Okay. So what you see here is our COVID dashboard that most of you, especially most Ghanaians, are familiar with. So this dashboard actually showcases what is going on as far as COVID-19 is concerned. And this we did in collaboration with the Sambus Geospatial and then Ghana Health Service. It's a strong collaboration we've built over time. In fact, we also want to thank them because our first dashboard that we had and all that, these ones were donated to us for free. And therefore, they supported us in configuring and all the other things that we did. So they've been very influential in that. So let's go to the next slide. One of the key things we did is that, our testing capacity initially started with only 2 sites. And then we graduated, went to about 24 sites. So we're able to also spatially distribute that for people to know where they can go and which labs are assigned to them. So these are also areas that we've also used that. Then we expanded our PCR testing and then GeneXpert testing and other testing to most of the regions. And this is how we are able to do that. So our people can easily identify areas, lab that are closer to them and go for the necessary support. Can we move? Okay. So these are just what I spoke about recently. We can go to the next slide. So what is the next? The other step we are doing is to also slow down community spread. So what activities have gone on has been the ban on social gathering, lockdown in areas, putting social distancing measures, restriction of gatherings and all that. What I would want to emphasize here is that the lockdown areas that you see, the partial lockdowns, were all influenced by the use of the geospatial technology, because it helps us to identify high-risk areas, and that is what we use in actually doing that. So if you hear the president speech saying that whatever we are doing is governed by data, then that is what he's talking about. So normally, we at Ghana Health Service does this analysis, go with our maps, and go to show it. We project it at the presidency, and based on that, we are able to determine which areas we think must be locked down or which areas must be opened and all that. So that is the discussions that went on. We can go to the next slide, please. So normally, we first of all do just the normal hotspot maps that shows us where the cases are and to determine where there are possible clusters. And then we go on to the next level of using other systems to kind of provide a smooth surface for that. So if you look at the previous slides, that was a kernel density estimation that we did to actually show which areas that we needed to take certain actions. So people in Accra will realize that some sports in certain areas were closed down, some schools in certain areas were closed down, and these were the influences, these were the things that were going on behind. So let's go to the next slide. So like we said, the use of our SORMAS, for which we have been using in contact tracing, is also a GIS technology that we are using. So it helps us to identify contacts where they are and follow them. And therefore, when we are also able to know where we have a lot of people or a lot of contacts that are gathered, then we know that this is a high risk areas for us to take the necessary precautions. So this is probably, for me, has been one of the ways by which Ghana has actually used the GIS technology ever in terms of our health dispensation, because everything that we've done from day one up to today has been the use of GIS technology. So this is what we use in actually following up on contacts. So let's go to the next slide. So this is the next slide that also even document actually the visualization of the contacts and all that, for us to know those contacts who probably start experiencing signs and symptoms, those who have been visited and all that. Let's go to the next slide. So this also shows us the distribution of these cases. Let's go to the next slide. All right. So in our current dispensation, when we are looking at vaccines distribution and rationing, because we don't have the vaccine that we need for the entire country. So the GIS technology is what is now influencing which districts we are supposed to move in. So you are there, and sometimes you receive that we've gotten 600,000 doses, we've gotten 100,000 doses, 500,000 doses, 1 million doses, and then we are there and we tell you, okay, we are doing it in district A, B, and C, and D. These are all influenced by our maps that we do. So we select which areas are recording the highest cases. Then we think that there may be other risk factors that predisposes them to that condition. And as a result, we try to put in measures or prioritize them. So these are how these technologies are being used. Now that I'm done with some of these things, because I may not be able to hit more on it, I want to give you just a short summary of what we have or how we have fared as far as the COVID is concerned. As at now, we have about over 120,000 cases. Positivity rate is about 7%. And then we still have about 5.01% of our people still being active. When we say active, people who can still transmit or the condition. But apart from that, over 94% of our people have recovered and discharged. And we have unfortunately lost about 1,100 people, unfortunately. But cases have been reported in all 16 regions and about 243 districts. So this just shows you the distribution of cases over time. So let's just move on. This one is just to let us know how. So I think we can just move on. And so this is how the distribution has been in terms of cases, mortalities, and all that. So this is just for you to have an understanding of how we are fed. Now we think that it is a big problem in terms of people with comorbidities. So we are advising people to monitor their cases, especially hypertension, diabetes, and all that. And we also have in mind that most people who arrive late at the hospital, they spend less than 24 hours. And therefore, we are saying that people who have suspicion of COVID should rush as early as possible to the nearest health facility. In our own way as the service, we are also doing other things to make sure to sensitize people to go early. And I think that there are various opportunities we can still expand on as far as COVID-19 and application of COVID is concerned. One of the key things is to build dashboard in each region so that each regions can do most of the things we are doing here. Currently, we are opening emergency operation centers in 3 regions. We've done for Western region, Ashanti region, and then Northern region. We hope to expand in other regions, and we think that These are some of the things we are going to collaborate on. I think I've had a discussion with Sambus Geospatial last 3 weeks to see how best we can build similar ones for the regions as they come up. And then there are also other areas I think we can explore. And I've also opened this up so that all of us can also contribute and look at how we can still use GIS technology in our COVID response with the aim of trying to improve on our response and saving the people of Ghana. Thank you very much for the wonderful opportunity.
Wow. Wow. Thank you, Mr. Ernest Akyereko. That was quick but loaded. Wow. Thank you once again. I think there's it's not a question. I think it's a compliment. It says, this from Dixon, and he says, I am impressed with the work done by the COVID team led by Mr. Ernest Akyereko. And so, Mr. Ernest, that is a commendation to you. Thank you. I don't know. Okay,
Thanks.
at the moment. Yeah. Mr. Ernest, you wanted to say something?
Oh, you know, I want to also thank him for appreciation to the team and what we are doing. I think this is the kind of motivation we expect. Even though sometimes I think we don't communicate much as to what we do, but we think that some of these compliments when it comes, it's also strengthening us to do better. So thank you very much, Dixon, for recognizing the efforts.
Yeah. Thank you. Wow. And so you can keep your questions coming. You can keep your comments also coming, and we'll read them out.